Welcome to another in our series of special presidential editions of the Washington Health Report. This week we hear from Republican presidential contender Senator John McCain on his plan to reform the nation's healthcare system, in his own words. McCain's proposal differs sharply from those of the Democrats who've taken the lead in making healthcare reform a priority. McCain says the key to affordable health insurance and more comprehensive insurance coverage is to bring healthcare costs down. He would give individuals tax credits to help pay for health insurance, and he would reform Medicare and Medicaid to sharply cut costs. Now, another hallmark in McCain's plan is freedom in the use of health care dollars. He would even allow veterans to take their VA dollars to other providers if they're not happy with the care they're getting from the Veterans Administration. He would increase competition throughout the system. For example, he would allow reimportation of drugs from Canada and elsewhere, and he would let people buy health insurance across state lines. But before I say too much, the point of the show is to let McCain describe his plan in his own words. McCain, like the other candidates we featured, described his proposals at a forum in Washington organized by Families USA and the Federation of American Hospitals. ReachMD is bringing the highlights of that forum to you exclusively on XM Radio. All of the candidates were asked the same first question. Do you believe that all Americans should have health insurance coverage? And how would you make that happen? Here's what McCain said.
Americans are deeply concerned about the availability and the affordability of health care to them and their families. And I would argue that there are some differences between candidates. Sometimes they're blurred. On this subject, there are some significant differences to that approach, and I respect everyone's approach to it. But I think we ought to have some straight talk to begin our discussion. America has the best quality health care in the world. Every time someone who's very wealthy gets sick, they come to America for treatment. We have the best doctors, we have the most innovation, we have the best hospitals, et cetera, et cetera. But what's the problem? The problem, my friends, is not the quality of health care in America. It's the cost of health care. In case you missed the front page of USA Today about a week ago, the headline was, Medicaid costs skyrocket. Medicaid last year inflation was over 10%. No system, no matter how high the quality, can sustain itself with double-digit inflation. So our efforts should be obviously to maintain the quality of health care in America, but our main object should be to bring health care costs under control. If we don't, Medicaid is going broke. I wonder how many young Americans know that by 2019 there will be no money left. And that's how we should begin this debate. How we're going to maintain not only these important programs for ourselves, but for our children and our grandchildren, and we have that obligation.
As part of his efforts to cut costs, McCain wants more transparency in the healthcare system. He cites as one example the cost of drugs. McCain thinks they're too high, and he thinks it's because of the powerful lobbying efforts of the pharmaceutical industry.
What kind of influence does the pharmaceutical companies have that they can get away with something like that? And I won't go into my rant about the influence of special interests. Foster the development of routes for safer, cheaper, generic versions of drugs and biological pharmaceuticals, and obviously safety protocols that permit reimportation, tort reform, and medical malpractice reform are vital.
McCain doesn't talk about universal health insurance coverage as the Democrats do, but he does have a plan to encourage more Americans to purchase health insurance. He would have the government give them incentives to buy. Now, when he's really pushed on the issue of universal coverage, McCain stops short, arguing that to really make that happen would require much more government intrusion into health care, more than he's comfortable with.
I don't think that there should be a mandate for every American to have health insurance. I think that one of our goals should be that every American own their own home. But I'm not going to mandate that every American own their own home. I think that every American should be available to an affordable college education. But I'm not going to mandate that every American go to college. I feel the same way about health care. If it's affordable and available, then it seems to me that, again, it's a matter of choice amongst Americans. And do we have to address the issues of pre-existing conditions and chronic illnesses? Yes, but the 47 million Americans that are without health insurance today, a very large portion of them are healthy young Americans who simply choose not to.
But wouldn't the cost of caring for the uninsured get pushed onto others who do have health insurance? Wouldn't we all have to pay higher premiums?
Well, look, as I say, the ones that have the coverage are the healthiest. The second, of course, are those, and they go to emergency rooms. I'm for walk-in clinics. Walk-in clinics staffed by a pharmacist and a doctor would relieve pressures on the most expensive aspect of healthcare in America today, and that's the emergency room services. So all I can say is that I'm not going to force Americans to do it. I don't think that's the role of government. But if we can bring down the costs, as I believe we can through a lot of the measures that I just talked about, including individual responsibility, then I am absolutely convinced more and more of them will take advantage of it.
For those of you who have just joined us, this is a special presidential edition of the Washington Health Report. We're listening to Republican presidential contender Senator John McCain describe his health care proposal in his own words. Now, bringing costs down is one of the things McCain would do to try to reform the healthcare system, and one way he would do that is by not reimbursing doctors or hospitals for medical mistakes.
What about the idea of saying, okay, to a healthcare provider, a heart transplant is going to be based on the overall outcome and care that you provide for that patient, and you will be gauged and paid by how that whole situation evolves. We should not be paying for medical errors and, frankly, mismanagement and improper care for patients under Medicare and Medicaid.
McCain's plan to give tax credits to individuals to purchase health insurance worries some of his critics. They say that kind of move would encourage employers to stop offering health care insurance, maybe even increasing the number of Americans without health insurance. McCain said he wouldn't expect that to happen.
If you preserve the employer tax credit, there's not a reason for them to drop it. They continue to have that tax advantage for doing so. But I think the important thing about the $2,500/$5,000 refundable tax credit for employees is for them to go out and make choices. When it's their money and it's their decision, I think they make much wiser decisions than when it's provided by somebody else. Ronald Reagan, who I love to quote all the time, once said, "Nobody ever washed a rental car."
McCain is himself a cancer survivor, so he knows all about this problem of pre-existing conditions and how they can make it difficult for a lot of Americans to get health insurance. But he does not favor using legislation to solve that problem.
Because I think then we would be mandating what the free enterprise system does. And that would be obviously something that I would not approve of. But I do believe that most chronically ill are covered now by employers' Medicare and Medicaid. But I also believe that we should broaden high-risk pools, and that would be a government function, to broaden the high-risk pools that many of them now have, and we need to help people who need it.
McCain also said that more emphasis on fitness and preventive medicine could ease the problem by reducing the number of people who get sick in the first place, which in turn makes it difficult for them to get coverage.
We all know that people with pre-existing condition and chronic illness also have to be cared for, but there are a lot of pre-existing illness, chronic illness that we could cure at a very early stage through incentives for wellness and fitness. I would also like to have the insurance companies be allowed and encouraged and have reasons for doing so, of rewarding wellness and fitness. Lower premiums or even a cash back to someone who doesn't smoke, to someone who joins a health club, for someone who keeps their weight at a certain level and their physical condition at a certain level.
Now, what about the problem of prescription drug coverage? In 2003, McCain was one of those who voted against expanding Medicare to provide prescription drug coverage. He explains why he voted that way.
We all know that there were people who were making a choice between eating and purchasing their prescription drugs. So what did we do? We covered everybody. We covered everybody. Why should you cover me? I vote myself pay raises all the time. So it was intended for people who were lower income Americans who couldn't afford it. Now we cover everybody. We also ask my 95-year-old mother to go online to choose who she wants. We also have put in provisions, thanks to the pharmaceutical companies, that we won't allow competition for these contracts for the provision of some of these drugs. We also prohibit reimportation from Canada. We know that the drugs, the pharmaceuticals in Canada are perfectly safe They're just cheaper. We don't want any senior to go to bed at night having to choose between their prescription drugs and whether they eat or not. That's not what America should be about. But it's not also an excuse to expand it to millionaires. I guess Warren Buffett is probably eligible. I don't think he needs my tax dollars to do it, as great American as he may be.
One of the problems with the American healthcare system, McCain says, is that advances in medical care always seem to drive costs higher. In other parts of the economy, advances often make costs lower, but not in healthcare. He has a few ideas about what to do about that.
The fascinating thing about healthcare in America and medical care, that every time there's an innovation and an advance in technology, and there have been so many in our lifetimes, it's astonishing. Most of them came from the United States of America, as we know. Every time that's happened, costs have gone up. In the rest of the nation and the world's economy, every time we've made technological advances, costs go down. Now, why is that? Why should that be? I think it's pretty, that there's a number of factors. One of them is that every time there's a new test or a new technology of some kind, doctors use it because they practice defensive medicine. And that's an argument for medical malpractice reform and tort reform. Another reason is because we don't use these efficiently, not just because of medical malpractice. We use them to great excess when they're probably not necessary to do so.
And finally, all of the candidates we've featured on the Washington Health Report have answered the same last question, and this is it. If you are elected president, where would healthcare stand in your personal list of priorities?
I'm also convinced that we're going to have to make some tough decisions, and Americans need straight talk to start with. We were unable to reform Social Security after the year 2000 election because we kind of confused the American people. We got all involved in personal savings accounts and who would have to be reformed. And what we really needed was a chart that said this much is coming in, this much is going out, this is when we're broke, and this is when there's no money left. We've got to do that with Medicare. And I am convinced, without a doubt, when the American people are properly informed and understand what's at stake, as there is in this issue, we know, according to, again, to most experts, the unfunded liability associated with Social Security is around $3 or $4 trillion. The unfunded liability associated with Medicare, Medicaid is $30-some trillion. So the enormity of the problem argues that we address it as quickly as possible.
That's all the time we have. You've been listening to Senator John McCain, the Republican presidential contender, on his health care proposals described in his own words. It's been brought to you exclusively on XM Radio by ReachMD. For podcasts of this program and previous presidential editions of the Washington Health Report, check out our website, reachmd.com. Thanks so much for being with us.